Let's cut to the chase, no fluff, no generic advice. 3 years ago, I collapsed during a marathon. Turns out, my healthy diet was missing key nutrients. Today, I'm breaking down 16 foods that rebuilt my health, backed by hard science, not trends. Stay with me until the end of this video. You'll discover essential information you never knew you needed. Cancer is a silent enemy, often creeping into our lives without a sound. The earlier you catch it, the better your chances of fighting back. But how do you know if your body is signaling danger? Today, we're uncovering 16 warning signs of cancer that you should never ignore. Some of them might surprise you, and knowing them could save your life. First, let's talk about unexplained weight loss. If you're losing weight without changing your diet or exercise routine, it could be a red flag. The American Cancer Society notes that sudden weight loss of 10 pounds or more could indicate cancers of the stomach, pancreas, or lungs. While weight fluctuations are normal, drastic and unexplained drops warrant a medical checkup. Next, persistent fatigue. We all feel tired now and then, but chronic exhaustion that doesn't improve with rest is different. Leukemia, colon, and stomach cancer can cause this deep, unshakable fatigue. If your energy levels have plummeted for no clear reason, it's time to speak with your doctor. Another alarming sign? Persistent pain. Bone cancer often causes severe bone pain, while brain tumors can lead to relentless headaches. If you're experiencing consistent pain in a specific area, especially without an obvious cause, don't brush it off. Changes in the skin can also signal trouble. Watch for dark spots, yellowish skin, or sudden changes in a mole's shape or size. Skin cancer, especially melanoma, can spread quickly, making early detection crucial. The Mayo Clinic advises checking your skin regularly and consulting a dermatologist for any suspicious changes. Unusual bleeding is another warning sign. Coughing up blood could indicate lung cancer, while blood in the stool may be linked to colon cancer. Women should also be aware of unusual vaginal bleeding, as it could be a sign of cervical or uterine cancer. The National Institutes of Health emphasize that any unexpected bleeding should prompt a doctor's visit. Digestive issues should never be ignored. Persistent indigestion, difficulty swallowing, or long-term bloating could point to esophageal, stomach, or ovarian cancer. If your digestive system feels off for an extended period, don't hesitate to seek medical advice. Persistent cough or hoarseness might seem harmless, but if it lasts more than 3 weeks, it could be linked to lung or throat cancer. A lingering cough, especially when accompanied by chest pain or blood, should be evaluated immediately. Unexplained lumps or swelling can also be a major red flag. Breast, testicular, and lymphatic cancers often present as painless lumps. Regularly checking for unusual growths and reporting them to your doctor can make a difference in early detection. Frequent infections or a weakened immune system may indicate leukemia, a type of blood cancer. If you find yourself constantly battling colds, fevers, or infections, it's worth getting your blood checked. Abnormal bowel or bladder changes should not be ignored. Long-term constipation, diarrhea, or blood in the urine could point to colorectal, bladder, or prostate cancer. Tracking these symptoms and sharing them with your doctor is essential. Night sweats and fever that appear without an infection could also be a sign of lymphoma or leukemia. If you're experiencing excessive night sweats and fever with no clear cause, further testing might be necessary. Persistent mouth sores or white patches inside the mouth could indicate oral cancer. This is especially common in smokers or heavy drinkers, making regular dental checkups important. A sudden change in appetite or difficulty eating may be linked to stomach or pancreatic cancer. If you're feeling full quickly, losing your appetite, or experiencing prolonged nausea, it's best to get checked. Chronic bloating or abdominal pain could signal ovarian or pancreatic cancer. Pay attention to long-lasting discomfort and swelling, especially if it doesn't seem tied to your diet. Back pain with no clear injury or strain could be a symptom of pancreatic or ovarian cancer. If your pain is persistent and unrelated to physical activity, consider getting screened. Finally, swollen lymph nodes that don't go away could be a sign of lymphoma or leukemia. While infections can cause swelling, persistently enlarged nodes without an infection should be evaluated. Cancer can be sneaky, but recognizing these warning signs early can make all the difference. Remember, noticing one symptom doesn't automatically mean cancer, but staying informed and seeking medical advice can be life-saving.